Welcome to UK Health Matters, where we highlight the groundbreaking work happening across UK healthcare to advance Kentucky together. Kentucky faces some of the toughest heart health challenges in the nation. But at UK Healthcare, we see this as an opportunity for discovery and progress. Through pioneering research, advanced treatments, and innovative prevention strategies, we are shaping the future of heart care right here at home. The UK Gill Heart and Vascular Institute is widely recognized as one of the best choices for patients with heart disease. Our cardiologists, surgeons, imaging specialists, researchers, and other team members work together to create personalized treatment plans for every patient. This collaborative approach ensures the right care at the right time, with specialists guiding every step. On this episode of UK Health Matters, we'll meet 3 leaders driving our progress in heart care. From new treatments to breakthrough research, their work means better options and better outcomes for Kentuckians.
My name is Julia Akhtarekhavari. I'm the Heart Failure Operations Director here at UK Healthcare. What that entails is working with our larger team to care for patients with the most advanced heart failure in the state of Kentucky. The most advanced heart failure, you're typically experiencing a lot of symptoms that are impacting your daily life. As that progresses, you may start to see issues develop with other organs in your body, like your kidneys or your liver. And so we are here to help you navigate from early stage to late stage throughout the whole process. We offer some treatment options that are not available everywhere else you may go. Those 2 primary treatments are left ventricular assist devices. So that is a mechanical pump that actually helps your heart pump blood. So when you have advanced heart failure, your heart is just not able to pump blood like it should. And this pump can help you do that. Another treatment option that sets us apart is we offer heart transplantation. There's a lot of testing that leads up to that. There's a lot of emotional stress that goes into waiting for a heart transplant. Our social workers and our nurse coordinators do a great job of supporting patients and their families through that process, all the way through potential surgery and after surgery as well. I'm incredibly proud to be a member of this team, the work that goes into taking care of our patients and their families. Throughout the history of our advanced heart failure program, we've been able to complete over 600 heart transplants and over 400 left ventricular assist devices. While that's just a number, what that really means is we've been able to help nearly 1,000 people have a better life, the life they want to live, a longer life. They get to see their loved ones accomplish milestones they wouldn't have otherwise been able to be present for. And that, at the end of the day, is why we're here.
I'm Peter Haigh. I'm one of the general cardiologists here at UK Healthcare, and I am one of the valve specialists. I sit on our valve committee, and I'm also part of the structural heart team as an imaging specialist. To talk about valvular heart disease, I think it's helpful to review what the valves in our heart do when our heart is beating normally. All right, you can think of the valves as little doorways in our heart that open and close to allow the flow of blood through our heart in an efficient manner. So valve disease boils down to 2 problems. Either the valve doesn't open properly, we call that stenosis, or the valve doesn't close completely, causing blood to leak back the wrong way, which is regurgitation. We have lots of different management strategies for valvular heart disease. Depending on what valve is involved and what is going on, we have multiple treatment options, both in the operating room and minimally invasive approaches in the cardiac cath lab. As part of our comprehensive valve clinic, we have multiple different roles and specialties involved, from the physicians like myself in cardiology, imagers, surgeons, and interventional cardiologists. We also are supported by a tremendous staff in terms of nurse care coordinators, cardiac pharmacists, and even cardiac psychiatrists help those patients that are struggling with the emotional and mental health components of heart disease. So here at UK Healthcare, we've been caring for patients with valvular heart disease for a long time, but the establishment of the comprehensive valve clinic will allow us to make sure that patients don't fall through the cracks. So this means that they see their doctor at the right time point in their care. They get the right surveillance imaging before and after they have a valve procedure. A few decades ago, patients who had valve disease, it meant they were going to the operating room for surgery. But now we have multiple treatment options, and in many cases, we can treat the patient in the cardiac cath lab through a catheter without the need for surgery and a much easier recovery time.
I'm Ken Campbell. I'm a PhD scientist and I'm a professor in the Division of Cardiovascular Medicine at the University of Kentucky. I mean, we have a lot of patients at UK Healthcare who have cardiac disease. There's a lot we can do for them, but sometimes there's some patients who come in with something that's really hard and, we're still trying to work out how to do it better. And so to me, research is all about trying to help patients and give better options for people who get sick. And that's really what motivates me in my research, to try and help patients. Right. So translational research is sort of a buzzword, and everybody thinks it means something different, so I get to define it myself, okay? So I think of it as like a spectrum of research. At one end of the spectrum, you've got people who are just studying, not just, but they're studying molecules, and it's very, we would say it's basic. It's very focused on the science. And at the other end of the spectrum, you've got people who are thinking about patients. They're thinking, if I've got 100 patients, and what's the best way of helping them with that condition? And I think of translational research as trying to bridge those two fields together. So you get the people that are thinking about molecules, and you're trying to make it more directed towards actually helping patients. My particular area especially, I know a lot about the molecular motors that make the heart squeeze. So that's really what I'm best known for outside UK. And there's a new technique called cryo-electron microscopy, which allows you to take pictures of individual molecules. And so what we did is we got samples donated by patients at UK Healthcare, and we worked with collaborators who are experts in this really fancy microscopy, and they got the first ever pictures of what are called cardiac thick filaments. So they worked out how the molecules were arranged inside people's hearts. And that gave us new clues about the ways that the molecules are actually regulated and how you can sort of activate them with new drugs, and hopefully that will lead to new therapies. So what we did is we combined this amazing molecular science with specimens that were donated by patients that we collected with help from the clinical teams, and we put all of that together. The thing that I work on the most is heart failure. In heart failure, people get sick because their heart either doesn't pump properly or because it doesn't fill properly with blood. So these are two broad categories. We don't really understand what's going wrong in either of these things. And we don't have the optimal treatments for people. There are things we can do to help, but if we knew more about what was going on at the molecular level, then we could really come up with therapies that were more targeted. And so that's really what my lab is trying to do. We're trying to work out what's going on or what's going wrong in the different sorts of heart failure, and then try and use that information to come up with more targeted therapies that will really allow us to make the difference. Here at UK Healthcare, we've probably got 50,000 patients with a diagnosis of heart failure. There's a lot of people out there, and we can do a lot to help, but we could do more. UK Healthcare is like an international leader in heart transplants. And since 2008, we have been asking people who are going to get a heart transplant if they want to participate in research. And when they choose to participate, and I think almost every patient we've ever had has chosen to enroll in this study, when the heart is taken out during the operation, the old heart, the one that's gone bad, it comes to our lab for research. And so we've built what's called a biobank of human myocardium from, well, we're now up to about 700 people. And it's one of the biggest banks of myocardium in the world. And we share those samples with 60 or 70 groups internationally. It's an international footprint for the heart failure program. And everybody's thinking, how can we try to help patients? And one of the ways we do it at UK Healthcare is we have the infrastructure to collect these specimens and share them with appropriate permissions with groups around the world. And it's not good that somebody needs a heart transplant. It's great when they get one, and it's great if the old heart can be used to try and help somebody else.
Thank you for joining us for this episode of UK Health Matters. To learn more about how we're working to advance Kentucky together, visit ukhealthcare.com.